Good morning. This is Dr. Avinash Jaiswal. I am Chief Medical Officer of CCM Health. I would really like to talk to you today about communication and information exchange, which has become more digital and social media driven compared to what used to be the print media. In my role as Chief Medical Officer, I interact with healthcare providers at various levels of the healthcare infrastructure, and I find that independent providers struggle the most with adoption of healthcare regulation, compliance, and financial reimbursement compared to institutional providers with their practice. At CCM Health, we have taken this as a personal mission to provide a positive impact on the geriatric population, especially the chronic diseases of diabetes and hypertension. Most independent providers are focused on care, and they do not have time to self-educate on what is a very difficult regulatory healthcare environment. And through the pandemic, we have seen a bunch of our providers that have had to close their doors, adding to what is already an access problem to healthcare for the vulnerable population. At CCM Health, we have decided to put in tremendous amount of resources on education of our independent providers, on social media, and we will be releasing a continuous amount of learning tools on clinical outcomes, on compliance, on practice longevity, financial survival, in order to give our independent providers the tools they need in order to thrive. So on this note, I thank you for your undivided attention, and I look forward to keep this conversation going. This is Dr. Avinash Jaiswal, Chief Medical Officer of CCM Health.